Joanna here. Today I'm going to review how to do a dressing change for a PICC line. So I'm going to refer to the checklist here, and I've reviewed the patient's health record and allergies, identified the patient and explained the procedure, and confirmed that the patient is agreeable to proceeding with this intervention. I've already cleaned the work surface. I'm going to perform hand hygiene and gather my supplies. And I would like to make sure that I have all my supplies gathered before the patient is sitting in front of me. So once the patient is sitting in front of me, I'm going to make sure that they're comfortable, and at some point you could also place a pillow underneath the patient's arm. At this point, I'm going to assess the site and measure the external length of the catheter. You could use any ruler available. It should either be disposable or wipeable. And I'm going to hold this right against the hub here with the suture wings and the insertion site, and it looks like the length is sticking out about 5 millimeters. So I'm going to remember that for when I chart about this dressing change in after I'm done. I am going to perform hand hygiene, and I'm already wearing my mask. And it says next to don non-sterile gloves. And then to prepare my sterile field. All right, so I open up my package. And I'm very careful at this point to make sure that everything remains sterile. So the sterile drape that comes in the package, you could put aside for now, and I will choose to put that underneath my patient's arm just to increase my sterile field. And I'll set aside these tongs here, and you'll learn how you like your sterile field to be set up. So I'm going to think, what exactly do I need on my tray? Well, first of all, I am going to wipe the site once everything is dressed down. So I'll open up my cleaning supplies away from my sterile field and use the tips of my tongs to drop it right into my tray. And I like using 4 swab sticks just to make sure that the site is nice and sterile and cleaned properly. Okay. I do make sure that the tips of my tongs remain in my sterile field. And number 4 here. All right. After I clean it, I know that I want to put the stat lock on to secure. So I'll keep everything as sterile as I can, and I'll open up the package and drop my stat lock as well as my other supplies into the sterile field, making sure that I'm keeping the tips and my supplies sterile. Okay, and then lastly, I open up my tegaderm that's going to go on top of everything, making sure that I'm not touching the inside. And I drop that right on top here. Okay. So my field, I believe, is ready at this point. So the next step is loosen the edges of the transparent semi-permeable dressing and remove. So at this point, I'm looking at my site here. The lumen is taped to the patient, so I'm going to choose to take that off so I could move the lumen around, take it down. So we could just rip it off really. because I want to clean the external lumen here. Now I could start taking this off, but if it seems like it's super sticky and difficult to take off, you could actually take some of these swabs and rub it right on to the tegaderm, and it does actually start to lift from the patient's skin. So you could do that. And you could pull perpendicularly as well. These, just these two here, then I'm just going to and I know they're overlapping here. And I'm just putting my thumb here just so that I know that the PICC line is secure. So say it's still sticky, you could take more of the swabs here and then just rub along the edges here on top. Okay, and then I'll start to peel off. So at this point, the insertion site is still covered by the tegaderm, and sometimes the stat lock is very difficult to remove. So knowing that, I could keep that covered, the insertion site, if I know that I'm going to take a while to remove the stat lock. And again, if you were to remove the stat lock and you're having a difficult time, you could rub the wings with the alcohol swabs, and then it starts to loosen. Okay. Then I feel like, okay, this is pretty loose. So at this point, I will just lift that a little bit and then open up the wings. And sometimes it is a bit sticky. So these are, I kind of look at it like a window, and you could see the suture wings have holes there where the poles of the stat lock fit into. And you could gently lift that there and then remove the stat lock and then throw that. And then now that you know that the stat lock has come off easily, you could take off the rest of the tegaderm. All right. Now and that's stated in the next step there, if the temporary stabilization device, which is the stat lock, requires replacement, remove that. Okay, so I'm going to take off my gloves here and perform hand hygiene. All right, then after I make sure that my hands are clean, I'm going to don my sterile gloves. Now the next step here, it says if permanent stabilization device in situ, use saline to clean. We don't have, again, a permanent stabilization device, we have a stat lock. Okay, so I'm going to don my sterile gloves. So if you haven't put on sterile gloves in a while, please practice this before you actually do this intervention with the patient. I'm just gonna put one hand in, making sure that fingers are in there. the greatest, but I'll fix it once my other hand is in. And grab underneath. And here I could fix my fingers so everything fits a little bit more snugly. Okay, all right, so once that is, I'll just throw that there. And okay, so one way to make sure that I don't touch anything that is not sterile, I clasp my hands together, just as a reminder. All right, so it says next that you could stabilize the line by holding with sterile gauze if needed. So you could take the sterile gauze that came with the package, and you could wrap it around the line like that, okay? So that now every time that you're touching the line, you can make sure that your fingers are sterile. Also at this point too, you could also add the sterile drape underneath the patient's arm. And you could ask the patient to lift their arm for you, and you could just fit that underneath. Okay, so you could cleanse the catheter skin junction with appropriate method of approved antiseptic solution, which we already have here. Clean everything that is underneath the tegaderm and a little bit beyond too. So we clean, I'll just show you one way, up and down, and you could count 15 seconds. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000, 11 1,000, 12 1,000, 13 1,000, 14 1,000, 15 1,000. So at this point, you could flip the swab and clean the other direction. So you cleanse 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000, 11 1,000, 12 1,000, 13 1,000, 14 1,000, 15 1,000. So it's the actual friction plus the cleaning solution that cleanses or disinfects the area. And then on top of that, making sure that you allow enough time for it to dry. So you just get rid of that. And also at this point, you could use this tape that has come with the Stat Lock package if you want to make sure that the line doesn't move on you. But I do want to get underneath the lumen, so I'm going to choose for now not to use that. But you use what you feel comfortable using, okay? So now I'm going to grab my second swab, and we already cleansed the top portion. I'm going to cleanse the bottom portion of it now. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000. And again, cleanse where the tegaderm is going to go, and you could go a little bit beyond that too. Okay, 9 1,000, 10 1,000, 11 1,000, 12 1,000, 13 1,000, 14 1,000, 15 1,000. Okay, and then flip, and then you could go the other direction. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000, 11 1,000, 12 1,000, 13 1,000, 14 1,000, 15 1,000. All right. So you've cleansed the area. Next step is that you cleanse the entire length of the catheter and allow that to dry completely. So again, I grab my other swab stick and I'm going to cleanse the top portion of this catheter. 1,000, 2 1,000, 3 1,000, 4 1,000, and so on. And I want to make sure that I get my suture wings. Okay. Okay. 12 1,000, 13 1,000, 14 1,000, 15 1,000. Now, because we're going to cleanse the bottom portion, you don't have to flip your swab stick. And you could count again: 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000, 11 1,000, 12 1,000, 13 1,000, 14 1,000, 15 1,000. Okay, and allow that to dry. And then lastly, I like to just make sure that the insertion site is cleansed really, really well. So I like to finish off with making sure that this is really clean. And again, I'll do my 15 seconds one way. Because that is the most important part, is the insertion site. And then flip. Okay, so that's 15 seconds each side. And then we wait until that dries, because again, it's not properly disinfected until you actually wait for it to dry completely. On top of that, if you don't wait until the solution is dry on the patient's skin and then you put the Tegaderm on top, the skin could start to react, and that will be really uncomfortable for the patient. So it's very, very important that we make sure that the solution has dried completely. And you could even ask the patient as well, does that feel dry right now? Because they would have a pretty good idea what feels wet and what feels dry. Now, obviously, this isn't real skin, so it might take a little bit longer for the plastic to dry or to look dry. But we are supposed to wait until it is completely dry for the patient and their skin. All right, so the next thing that we do is to apply the new temporary stabilization device if required, which is our stat lock. It comes with a skin protectant or barrier prep, which we want to make sure that we use. And this just adds an extra layer for protecting the patient's skin. So we could open that up and apply it. Make sure that you avoid the insertion site, because it might be irritating at that point right here, but you want to be able to cover everywhere that anything sticky is going to touch. So just around there, and then especially where the stat lock is going to be. And then again, you just wait until it dries completely. Okay. And it is sticky. All right, again, we wait until that completely dries. We will apply the new temporary stabilization device, and make sure when you put it on that these arrows are facing the insertion site or are towards the patient. Okay, so at this point you could lift your catheter. Once you make sure that everything is dry underneath, and you could fit the suturing holes right into the poles of the stat lock. And now at this point you could close the windows, and it is a bit stiff sometimes. So I haven't taken off the sticky yet on the back, and it does click. Okay, so before you take the protection off the back there, make sure that it is situated where you want it to be. Okay, so you could ask the patient or whatnot, and this is exactly where I want it to be. So at this point, I will remove that side, and I'll remove the second side. Okay, and then we'll just make sure that it's on there pretty good. And then it says to apply the sterile dressing, ensuring complete coverage of the catheter skin junction, catheter, and stabilization device. Okay, and it also prompts you to not stretch it. Just remove the backing here. And it's helpful sometimes if you have someone to hold the port for you, just because there is this slit. So make sure that the junction site is covered, and you could cover it like that. Good. Now remember, so now you don't have to be sterile, right? Because everything is covered. You could remove the border at this point. And then you could write, or you should write, the date and time on this, okay? And apply it to the dressing. Make sure you don't cover the insertion site, because that's what people will be assessing every shift. And also there's these 2 extra strips of tape that you could cover as well, just for some extra securement. Okay, and there you are. And then you could take another gauze and you could cover that again for patient comfort. And that is how you do a dressing change for a PICC line.